So adenosine is a naturally occurring purinergic nucleoside that occurs in the human body. And previous studies show that infusion of adenosine can cause headache for cardiac investigations. And also we know that caffeine can, it can trigger migraine attacks, but at the same time, in combination with simple analgesics, caffeine is also able to treat migraine attacks. So based on these observations, we have hypothesized that giving adenosine infusion to migraine patients might actually induce migraine attacks. So to investigate this, we conducted this randomized placebo-controlled crossover study, in which our primary endpoint was to investigate the incidence of migraine attacks following adenosine compared to placebo. So 18 patients were included in the study, and they were randomized to receive either adenosine infusion for a 20-minute infusion, or saline for a 20-minute infusion on 2 separate days with a 7 days washout period. And this was, of course, done in a crossover manner. So they went through both saline and adenosine on 2 separate days. And during the infusion and after the infusion, for every 10 minutes, we asked the patient regarding their headache characteristics. Vital signs were measured, and we also measured the diameter of the superficial temporal artery and the velocity of the blood flow in the middle cerebral artery. When patients were discharged, they were given a headache diary that they had to fill out at home and then send in to us, of course, to see if there was anything in the time that they were discharged afterwards for a period of 12 hours post-infusion. A total of 18 patients were included in the study and randomized to both saline and adenosine infusion. And what we found was that 7 out of these 18 patients reported migraine attacks after the adenosine infusion, compared to 3 patients after the placebo infusion. However, this was not statistically significant. At the same time, the induction rate of headache itself, so not migraine, but like any kind of headache, was shown to be present in 14 patients out of the 18 following adenosine, and then in 6 patients following the placebo infusion. And this was statistically significant. So this is like just the headache and the migraine induction rates. If we then look at the vessels, we found that there was a short-lasting dilation of the superficial temporal artery and a decrease, again, short-lasting decrease in the velocity of the blood flow in the middle cerebral artery, which you might say that it's an indirect way of saying there is a dilation, but there's other aspects, of course, that need to be considered as well. So we cannot say that for sure. So overall, in conclusion, we found that adenosine does induce headache in migraine patients, but not migraine in migraine patients. And our inability to see that it could induce migraine attacks in migraine patients could be due to the counteracting effect of the adenosine receptors. So therefore, future studies, again, should focus on the adenosine receptors rather than just adenosine as a compound.